All right. From smart surgery, it's now time to turn our attention to mental health. You've heard the numbers by now, I'm sure, but they're worth repeating. 1 in 4. That's how many people are estimated to have a mental health issue worldwide. The economic cost is huge, but the human cost is higher. Then there's the role of tech to consider and whether it is friend or foe in the fight for mental health. We've lots to discuss, so let's get started. Please welcome in conversation with Ashley McKimm from the British Health Journal, Chief Science Officer of Headspace Megan Jones, and Professor of Psychiatry at King's College London, Dame Till Wykes.
So, Till, Megan, welcome to the Health Stage. Thank you for joining us. We've only got 25 minutes, so I want to get straight into the discussion, and hopefully we'll take some questions from the audience as well. But let's start with the fundamental question for the session, which is, do we need new options in mental health? And is tech the answer? So maybe, Till, if you could comment on that first of all.
Okay, well, most people know, I think, from the press that mental health services are pretty poor, or you might know somebody, a 1 in 4 person who has a mental health problem, who has trouble getting a mental health service. And so it is likely that tech could help us, but it could help us in different ways. So in stepped care, so you might want to introduce some form of app to help people self-manage before they actually come into formal health services. But actually, you could use the same kind of app as people come out of mental health services as well to help with their recovery and maintain their functioning. But one of the issues, I think, is that we need to have a blended approach to this care. It can't just be mental health apps for all and no services. It needs to be clinicians involved in developing mental health apps. It needs the service users, the mental health people with mental health problems involved in developing the mental health app. So I do see a way in which tech can help. And in fact, we're using tech at the moment to see if we, in the radar CNS study, to see if we can predict problems in mental health. So in particular, predicting whether people with depression, if something happens to their behaviour, so that you could predict when they would have a relapse. That way, we could get in quick, provide them with treatment, and we know that faster treatment means that you're going to have a faster recovery.
So you've mentioned apps a couple of times, and Megan, you're Chief Scientific Officer at Headspace, one of the biggest providers in this wellness space. We talked earlier about 1 in 4 people having mental health problems. WHO says they estimate about 500 million people have mental health issues at any one time. How much potential do you think there is for tech to help to deal with this?
I think there's an enormous potential, and I think there's also a responsibility. And I absolutely agree with everything that Till described. I think what I'd add to that is that there's an opportunity to promote health and to intervene in building resilience before people progress to developing a mental health disorder. And I think that's a space where we've focused a lot at Headspace, and I think are making an increasing global health impact. We alone have 35 million users in 190 countries. And there are many ways that we can, not only through our app itself and bringing meditation to the masses, intervene, but also through our brand and changing culture around mental illness and around promoting your mental health before it becomes a problem. So that's a lot of the work that we've done with professional athletes and trying to pull them into the cultural conversation around finding strength in our vulnerability, talking about using apps like Headspace or practices like meditation to build your resilience, reduce stress, and kind of enhance your own abilities to manage your health yourself.
Okay, and tell us maybe a bit about some of the successes you've had. So what impact have you had globally with the app that you've got?
Well, the impact that we've had globally, I think given that our app is currently only in English and we have 190 countries, is pretty positive. And we are in the process of translating it into other languages. And I think importantly, the way that we're structured in having a free aspect of our experience as well as a more intensive aspect of it is important, because we want to provide access to everyone, to not have it be a kind of elitist opportunity in terms of improving health. And importantly, we're also working both in the US and in the UK and a number of other countries increasingly to integrate meditation into healthcare. So we're working with patient advocacy organizations, patients, physicians, healthcare systems such as the NHS to find ways of integrating this with clinician support, where we're actually providing meditation for patients with depression. We've integrated it into cancer treatment and a large healthcare system, Kaiser Permanente, into the US, where we're improving quality of life, both for the patients and their caregivers, through offering our services.
Okay, very good. So I think we've seen a flood of apps, healthcare apps, wellness apps, mental health apps onto the market. And there's obviously some concerns with those as well. So Till, I wonder, can you comment on some of the concerns we should have and some worries we should have about the flood of healthcare apps into this space?
Yeah, there's 325,000 so-called health apps. Wow. 78,000 added last year. And who knows if they're really a health app? And that's the main difficulty. We do not know whether they provide benefits. Stars on the App Store do not indicate whether something actually helps. And there is a risk of having mental health apps or any other software to help mental health, because it may delay vital treatment. It can help in self-management, but if it delays treatment, as I said earlier, faster treatment means faster recovery. If you delay treatment, then recovery takes much longer. It's much more expensive and inefficient, both for the healthcare sector and for the individual concerned who has to put up with the mental health distress for much longer. So we do need evidence on benefits, and I must admit I get very irritable about app developers saying, well, the speed of development means that we don't have to do what is the key issue, which is a randomized controlled trial to show it has a benefit. Otherwise, it's a leisure activity. And so we do need to make sure that we have real, proper evidence. And the risks are also that people say it's beneficial, but we need to know how many people it doesn't benefit. There will be some people who don't benefit. And if individuals fail at using an app, they don't get a benefit, and they think, well, everybody did benefit, they will feel even worse than they did at the beginning. Yeah. So app developers need to develop apps with mental health service users and clinicians in order to have something that's feasible. We need to know what dose is important, and we need to know what benefits we might expect.
So let's come back to that. I think we want to dive into that a bit more. But maybe, Megan, just reflect on the fact that Headspace is a hugely well-rated app. People love it. What have you done to look at the evidence of the impact of what you're doing?
Well, I think this is, in the case of Headspace, the founders had the foresight to really realize that in order for us to be able to measure our success against our mission, which is to improve the health and happiness of the world, that from day one we needed to start collaborating with academic researchers, with physicians, mental health experts, to start to clinically validate the effects that we're seeing. We didn't hold back launching the app, but the claims that we make about its benefits and the way that we contextualize using it for people stays within the zone that is well established in terms of the benefits of meditation. So the way that we talk to our, the public, consumers about Headspace is in relation to very well established benefits around focus, around stress reduction, around improving compassion, reducing aggression. And as we move increasingly into the healthcare space, we have invested quite extensively, I think more than any digital health company in the consumer space that I'm aware of, in research. So we currently have about 65 different clinical trials that are being run by academic centers to look at the impact of Headspace across different populations, both very rigorous controlled trials that will feed into the work that we're doing around a new digital therapeutic version of Headspace called Headspace Health that will be pursuing FDA clearance, as well as understanding, this cancer implementation that I described is part of a series of research studies in collaboration with this healthcare system, patients, and clinicians to really understand the impact, as well as understand what the implementation needs to be so that it's set up for success. It's not only about doing the high quality, rigorous research to be able to have strong evidence for every claim you make, but to also be able to set people up for success. So if I'm a cancer patient and you tell me that Headspace can help improve my quality of life, how often do I need to use it? Do I need to get my caregiver on board? How does my physician know how I'm doing and integrate this into my care in a way that really maximizes its impact? So these are all things that I think as a company you need to hold yourself responsible for. But research doesn't happen overnight. This is long-term strategic work. And so I really would describe it as a parallel path in terms of there may be certain commercial activities in terms of launching into healthcare that you need to hold back until you have built this evidence. There are certainly certain claims that you also need to hold back or better contextualize so that people are very clear how to use your product and how it may help them. And if it doesn't, what to do instead.
So thank you for all your questions and thank you for voting them up.
Yeah.
We'll take some of the questions as we go through, but maybe to kind of...
Yeah, I wanted to answer a couple of them that are actually already there, which is about the regulatory environment, because I think that comes from issues like most regulation requires things like a randomized controlled trial. Certainly NICE in the UK requires some evidence of efficacy. The FDA, though, are interesting. They've just agreed a behavioral health app for addiction, which was not based on the app. They've given the regulation to the app, but the data was collected on a web delivery. And actually, web delivery on a computer is totally different from an app. The dosing's different. You access an app in different places than you do a computer. So you do need, I think the FDA need to sort of step up in that regard and understand what an app really does and is. So I agree with Megan, we need stuff about dosing, but also I think there's a space now for app stores. App stores advertise health apps. They make money out of selling health apps, and yet we've no idea whether they are health apps. They're just what the developer said they were. Well, they're a green app one week, they're a yellow app the next. Who knows if they're both health apps? So I actually think, and I've been writing about this with Stephen Schuler, that we need 4 principles which the health app store could have next to the point of download. So effectively, at the point of sale, we need principles like specific information about security and privacy of data, not having to read 25 pages of terms and conditions. Service users, mental health service users, want to know who's got my data, is it safe, and are you going to give it to somebody else? They're very simple questions that you can put. Doesn't have to be legal jargon, just very simple things. We need to know about the development. So was the app developed with service users and clinicians? Was it tested with service users and clinicians? Not tested on slightly unhappy undergraduate students, which is quite often how the apps are tested. We need to know the dosing. We need to know about feasibility and dosing, and we need to know about the benefits. And app stores need to step up. They have a responsibility to vulnerable individuals who are going to make decisions about downloading. And they shouldn't have to expect the people who are now buying sometimes these health apps to go to another website that's reviewed health apps before they actually go and download. We need that information in the App Store. It's of commercial advantage to any developer to provide that information. And the regulation of that information, I think, is advertising standards. You know, we know that the Federal Trade Commission fined Lumosity and a number of other apps for saying that their apps did things which there was no evidence that they did. Well, they could just be, any app that doesn't do what it says on the tin would go to the advertising standards authorities.
So is this government or is this app stores and tech companies themselves?
I think Google and Apple need to step up with their stores. I think they really need to put information for the consumer at the point of sale. And they have a responsibility now, and particularly given the Cambridge Analytica scare, people with mental health problems really are sensitive about where their data is going. You know, we all know there's no such thing as a free app. Free apps are selling something of yours or buying something of yours to use for commercial advantage. Some people would never download an app which did sell on their data. Others would balance the effectiveness and benefits of the app against the likelihood that their data will be used. And that is a nuanced approach that mental health service users do in making their decision. They balance things out. And they're not going to read 28 pages of terms and conditions. Okay. That's my rant.
It's a good rant. So, Megan, there'll be lots of people out here who are developing apps in this space, and you've been involved in the ed space for a long time. You're quite established in the market. If we do have regulation, what impact does this have to you, and what have you been doing so far to deal with some of those concerns that Till mentioned?
Yeah, no, I think that we've actually been quite active in engaging within industry and in partnership with our academic community around trying to create standards, because we believe we need to have them. I mean, when we are deciding whether or not we say something about Headspace, we're going through an extensive review of the research that we've already done about Headspace in partnership with academic researchers. The way that we design studies is increasingly rigorous and is essentially, if we're going to make a claim, we need to have robust scientific evidence to back it up, because the FTC otherwise what kind of puts us in a vulnerable position. So, whether or not consumers are expecting to see that kind of evidence, I think right now they're not quite sure what to do with it, at least in terms of the masses. But we'd like to lift up the standards overall, and so have just elected to hold ourselves to these this higher level of expectation. I think there are organizations that are being established, that are growing, that are trying to bridge the academic or clinical community and tech so that we can talk to each other, because this must be a collaborative process. And I think as app developers, we need to take a sense of responsibility for understanding our impact. We need to look at, when we design an ad, how do people actually experience it? Because that could be health promoting, or it could be reinforcing stigma that we're trying to change. And so I think if you think of everything that you do as a health app, as having a purpose of improving health, it really helps reinforce your decisions. If you look at your software quality system from that lens of, we need to have a reliable experience so that something that our members or users are depending on to help manage their health, it needs to exist, it needs to be there, it needs to work when they open it. And so I think this is a sense of just elevating standards overall.
Good. So let's take the top question on the list of questions that's there, and I think it's taken us to the even more vulnerable group. So a lot of mental health users are vulnerable, but children even more so. And I want to ask you whether you think, first of all, would Headspace ever launch an app for kids? And is it ever a good idea? And what do we have to do to kind of make sure that's a regulated market?
Well, we have kids content in the app right now, and the way that it is intended to be used is by a parent with their child. And so we believe that first is important. We also are engaged through, we have a philanthropic arm of the company, a social impact department that focuses on working with organizations. So we partner with organizations like Bring Change to Mind, which works on mental health programming in schools. And so we're working with selected partners, with school districts, for example. We provide free access to Headspace for over 60,000 teachers in the Los Angeles Unified School District, as well as Detroit and Newark. But importantly, before we roll something out directly to kids, we must have evidence, because as you said, they are a vulnerable population, and evidence matters even more. I'm a child psychologist by training, and I think we need to understand how we are designing things specifically for children rather than adapting adult interventions down for children, because they're very different, their brains are different, and we must think about them within their system. We need to think about, and this is part of why Headspace's app is focused on parent and child interaction around the use of meditation, because kids get better when their families get healthier, when their schools are better, more supportive environments where they use meditation instead of detention. And so I think if you have this systems approach, it can really set you up for success in terms of how you're intervening when you care about the lasting efficacy.
Okay, so I run a young person's mental health group, and they're 16 to 26. We're now getting people 10 to 16 to help researchers, actually, mainly, about their design of their studies. Most of the people from across the country who've come and talked to that young person's group have been designing apps for young children. And one of the interesting things about the feedback from those people, from the young people themselves, is, yeah, but where's the person in this? Isn't there a person for us to talk to? We're on our phones all the time. We don't want to be on our phones just for this. So I think that one of the big issues is that if there's any plans to develop any mental health interventions, there must be a user group to provide the right feedback. And certainly most of the studies that I know have now been changed, and most of the design of the apps or the computer programs have been changed in order to allow some human contact, as well as, and this is not just for well-being, this is actually for kids who have OCD or ADHD, and this is an ongoing current study at King's College London, which is doing a development of a post-traumatic stress app for young people. Because one of the big issues, mental health services are pretty difficult to get hold of, even in the UK where I work, but actually children's mental health services in the UK are pretty poor, and part of that, the problem about them being pretty poor, is actually having experts in the system. So we have a long lead-in time before we get the right experts in the right place to deal with these problems. But I wanted to deal with one of the other questions at the same time, which is the pharmaceutical companies. So pharmaceutical companies, I think, and insurers. So pharmaceutical companies are now getting interested in tech. They're seeing it as another arm of their work. And I think in the young person's field, given the general lack of evidence of drugs and the negative consequences that we've had of giving out adult drugs to children, I think that is a space that the pharmaceutical companies are likely to start getting into. But also in terms of insurers should be paying for these, because it may be a cheaper way of providing services to have a kind of blended care with a sort of tech intervention plus formalized clinical care. And maybe insurers need to pay for the randomized controlled trials to actually find the benefits so they know which ones to recommend.
Yeah.
The FDA is not going to do that. Yeah. It seems quite likely that developers won't do that for a while unless they really step up and be responsible, although it's to their commercial advantage to do it.
Yeah.
So maybe I've just answered at least 3 of those questions that we've come up with.
So it sounds like it's not a straightforward process. I think it's going to be interesting to see how the regulation evolves over the next couple of years. We've actually got GSK on the stage this afternoon talking about pharmaceutical industry and digital health, so do come back for that. We're nearly out of time. I want to ask you just to sum up. So we've got lots of people here involved in mental health wellness apps. one piece of advice for them. What is the thing they need to think about most whenever they're going away and working and things like that?
I think you must engage experts in that process. And so, as Till was mentioning, this is part of our process at Headspace, working with the end users, with the patient population that you're trying to reach, with advocacy organizations, and with clinical experts and academic researchers. You need to pull that into your organization early on to make sure that you are aligned with best practices and that you are setting up those trials that will bring that evidence on board when you really need to scale.
So I don't want to just repeat the script, but perhaps to say that when Megan said early on, what you need to do is find out what people with a mental health problem want, not what you can produce that's new buzzy tech and a bit boys' toys. Maybe that isn't the right space to go into. If you are a responsible app developer, you will be working out which areas are the key ones that people need help with. It's, again, a commercial advantage to do that because it's likely that the app will be feasible and probably effective. So always engage before you start, not when you've got the idea and you've mapped out the software program that you want to involve or the coding. Do it now.
Wonderful, thank you. Thank you all for joining us. We're out of time. Please hang around for the next session, but can I ask you to put your hands together for our two speakers today. Thank you.